On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block here at the ACC annual meeting in DC, and we're covering the late-breaking clinical trials. PCSK9 antibodies have been a high point of all the late-breaking clinical trials, and with me is another investigator, Dirk Blom from South Africa, who has done the long-term follow-up on PCSK9. So, Dirk, tell me about your trial. How does it differ from some of the others, and what's the outcome?
So our trial was the longest double-blind randomized control, so it's a lot longer, it's a lot bigger than all the other trials, and we had patients on very different levels of lipid-lowering therapy. We had some patients who were on diet alone, and some patients who were receiving atorvastatin 80 plus ezetimibe 10, so a very wide range of lipid-lowering therapy. So it's the longest, the biggest trial thus far.
So how long did you, in fact, follow these patients?
So these patients were treated for 52 weeks, receiving the drug subcutaneously once every 4 weeks by injection.
Okay, so there's a couple of issues that come up about PCSK9. Number one, how often do you have to give it? I guess once a month is probably enough. And the other question is, compared to 12 weeks, this is a much longer trial. What are the differences outcome? Any difference, or does LDL continue to be really low?
So LDL continues to be low. We looked at the 12-week versus the 52-week data. There's no difference. The effect is maintained over those extended time period. So we have no loss of efficacy whatsoever.
Sounds to me like this PCSK9 business is going to probably pan out if we get some differences in outcomes. What are your thoughts?
My thoughts are it's a very exciting therapy. We lower LDL cholesterol very dramatically, and the patients seem to tolerate this therapy extremely well. Clearly, we need the outcome data to have a final analysis, but I'm very excited about this therapy.
Okay, well, I guess that's about as good a summary as I could ask for. Thank you very much, Dirk.
Thank you.